All right. So what do you do if you're a therapist and your patient is high risk for suicide? You've done in the assessment, they're high risk. Okay, so this is what to do next. You're going to want to de-escalate them, get them to be cooperative. If they're having some sort of psychosis, this might be difficult, but this is important. It is an important step. At that point, if you have an emergency contact that can take them to the hospital, great. That would be, yes, you break confidentiality. You let the emergency contact know this person needs to be taken to the ER. They need a 72-hour hold. So they're taken to the ER, they're evaluated there, then they're taken to a 72-hour hold. At least that's how it works in my state. If there is no emergency contact, maybe as a therapist, you are not totally comfortable even assessing this. There are mobile crisis teams that can come out and do this sort of thing for you. So if you are not comfortable doing this, okay, then you can reach out to one of them. If you are, what's the next step? Well, you call 911. You let them know I have a patient. They are actively suicidal. In my state, I say I have paperwork filled out. If I don't, police come, they fill out the paperwork and make sure the patient gets on the gurney. Now you think about police coming to a situation where someone is immediately suicidal, you think, wait a second, they aren't trained for this. In many states they are. They receive a 40-hour training by a therapist. It's a CIT certification, crisis intervention training. So you can ask for a CIT officer, and that can help. Essentially, the other police come to make sure like no one is harmed, that everyone's okay, but that officer is trained in de-escalating and getting them to be cooperative and get on the gurney. But if you can do this ahead of time and kind of get them to be on board with, okay, look, can't trust yourself, we're going to need immediate stabilization, we need to get you to hospital and get some medication so that you're immediately feeling better. Because right now you're such a high risk, can't trust yourself. If you can have this conversation and de-escalate your patient, and you can let the police know, or over the phone when you call, let them know they are cooperative, great. It's going to be a much, much better, easier transition. What you can't do and what you should not do is let your patient go if they're immediately suicidal. You don't want to neglect your patient when in their greatest time of need, and you don't want that on your conscience if they die. Is going to a 72-hour hold super uncomfortable? Yeah, nobody loves it. Is having police come uncomfortable? Yeah, nobody loves that. Are there instances where it kind of blew up and people got hurt? Yeah, unfortunately. This is why it's important to de-escalate, and this is why it's important to communicate with a person on the phone. Ask for a CIT officer, let them know they're de-escalated, let them know they're cooperative, let them know that they just need to be taken to the ER. If there's an emergency contact, you can bypass this. Have them take them to the ER. But you can't let them go alone. You can't do that. So you're going to want to make sure that they go. So what the process looks like is patients taken into custody by law enforcement or medical professionals. They're usually taken in an ambulance. They're transported to the hospital. So there's custody, transport, then medical exam. A patient is examined for medical problems. A patient is evaluated for potential harm to self or others. Again, they're evaluated. So not just by you or the police officer, they're evaluated at the hospital. Then with that certification, they are then taken to a 72-hour hold, a psychiatric unit, and admitted and then held for 72 hours. This is what it looks like in my state, and it might be different for you in your state. But it is important to de-escalate. It is important that you communicate what is going on and that your patient is safe. You let them know. So hopefully this is helpful. If there is still resistance to call 911, gotta work through that. You want to make sure that your patients are safe and they don't get hurt. And this is a way to make sure that they don't die by suicide. There's a legal and ethical obligation to make sure that your patients are safe. So if you can do it another way that's ethical, okay, yeah, emergency contact, cool, do that. Otherwise, when you call 911, let them know, de-escalated them. Or if they're in psychosis, let them know they're in psychosis. Sometimes that happens and sometimes it sucks, but you want to make sure your patient is safe and not going to die by suicide. Ask for a CIT officer. That's going to make a big difference if you have an officer that's trained versus an officer that's not. So you need to communicate on the phone what is happening. But you need to do something. In this next video, I'm going to talk about what happens after this. What happens when they get out of the 72-hour hold, how to go with that sort of treatment, and also what if they're not high risk? What if they're more immediate risk? Short version, safety plan. So next video will be about that. What is a safety plan?